Hi, hello, welcome to my YouTube channel. Come on in, take a seat if we haven't met before. My name is Kel and I'm a therapist and educator with a special interest in eating disorders. Today, the 10th of October 2021, is World Mental Health Day, and the focus this year is on mental health in an unequal world. And what better day than to launch my YouTube channel and post my first video. If you want to wait around until the very end of this video, I will be taking a moment to let you know what my plans are for this channel, but for now I just want to get straight into it. So as I just mentioned, the focus today is on mental health in an unequal world, and I'm sure across the internet we're going to see a plethora of information with particular focus on perhaps how factors such as socioeconomic stance impact individuals' access to mental health care. But I want to focus on something that is a little more particular to me, and that's weight stigma as it pertains to access to eating disorder treatment services. You might be wondering what weight stigma has to do with accessing eating disorder services, but the reality is that stereotypes and stigma surrounding eating disorders are so pervasive that it absolutely is a factor. You might be excused from not understanding that the vast majority of individuals living with an eating disorder are not underweight. And we actually have something that we refer to in the eating disorder field as the swag stereotype. This is that the assumption is that eating disorders particularly affect skinny, white, affluent girls. This is a problem. It's a problem because this stereotype means that many, perhaps even millions of individuals impacted by eating disorders struggle to access the care that they need because of the stigma of this belief. In fact, many people affected by eating disorders are in a straight size or higher weight body. There might be men or middle-aged or older adults, and probably some people that I've failed to include here as well. And all of those individuals could be struggling with a serious and potentially life-threatening eating disorder, irrespective of their body weight. This swag stereotype affects everything from an individual's ability to recognise that they themselves might be struggling with an eating disorder, despite perhaps not being in a lower body weight. And it might also impact the experience an individual has when they reach out to other people, including healthcare professionals, in an attempt to be referred to specific eating disorder services. The thing about this stereotype is that it's pervasive. I've been working in the eating disorder field in some way, shape or form for about 15 years, and it still seems that very often when I go into a classroom to teach about eating disorders, there is some surprise to hear that the vast majority of people with eating disorders are not underweight. And this tells me that the average person on the street, but also the average person in a medical setting, still believes this idea. In fact, it's well documented that many people, when they first go and visit their GP, especially if they're in an average or higher weight body, find that their needs are dismissed, that it's not necessarily even an eating disorder that they are screened for, despite expressing that they are partaking in behaviours such as perhaps binge eating or self-induced vomiting. If at that point the GP or perhaps the practice nurse is educated enough on eating disorders to understand that this individual may indeed have one, they might face another problem, and that is that they perhaps wouldn't meet referral criteria for the eating disorder service local to them. This actually isn't supposed to be the case. NICE guidelines state that eating disorder services shouldn't use an individual's body weight as a primary referral criteria. However, the reality is that there just isn't enough funding for eating disorder services, and that means that somebody in an office somewhere having to decide how we prioritise individuals to access these services has to come up with benchmarks and referral criteria that can be assessed for and managed in cost-effective ways. You can see how it might be considerably cheaper to ask a potential patient to simply hop on a scale as a way of determining whether they can be referred to a service, rather than offering a complex psychological assessment. And it seems that unfortunately that's the reality that we're met with. This benchmark for referral that, at least from where I'm sitting, seems to be more about finances than actual eating disorder care also then perpetuates the belief to those that are asked to enforce that referral criteria that the people with the most serious eating disorders are significantly underweight. However, the reality is that many people every year die of eating disorders. In fact, eating disorders have the highest mortality rate of all mental health conditions. And about 50% of those deaths are as a direct result of suicide, which of course has absolutely nothing to do with an individual's body weight. And many people, unfortunately, lose their fight to an eating disorder at apparently healthy weights or in higher weight bodies. I speak to individuals almost every day who have been impacted by this, who have perhaps at some point in the distant or even long distant past have attempted to access services and been rejected, have attempted to have access services and felt that their needs were just ignored. It is then significantly harder for them to choose to come forward again in the future, for them to try again to access the care that they so desperately need. In private practice, I have the luxury that I can work with anybody and I don't have to sit by set referral criteria. I hope that by doing this, I'm doing my tiny little bit to not perpetuate this idea that weight equals need when it comes to accessing eating disorder services. But the question has to be, how do we do more about this when it comes to statutory services for eating disorders? Unfortunately, it's really complicated. It's really complicated because this swag stereotype is something that the average person believes. And in order to get past that barrier, we have to educate the masses about the reality of eating disorders affecting people of many different shapes and sizes. And that's exactly one of my goals in creating this video and in creating this entire channel. But even then, if we educated everybody, we would still be met by this challenge of finances. The reality is that eating disorder services are chronically underfunded. In fact, mental health care in general is chronically underfunded, but this is particularly true when it comes to eating disorder services. Clinicians in mental health settings in the NHS who specifically work with those with eating disorders are basically firefighting. The entire forest is on fire, but they just have a couple of buckets of water to try and put some of the flames out. And so they're chucking water on the flames that they can immediately see. In order to actually put this fire out, what it seems to me is necessary is for everybody to take a moment and take a step back, pool resources, and then try again. But I don't know how realistic this is in the current economic climate. We can, however, all make a small difference by listening to those people that disclose to us their struggles of eating disorders, by listening and taking them seriously, irrespective of the way that they look. And I hope that today, as a consequence of watching this video, the next time you find yourself in one of those conversations, you do actually respond with the care and compassion that that person deserves. We are going to have to fight for funding for mental health and specifically eating disorder services. But until those changes are put in place, you watching this video right now can be a tiny part of change. You can choose not to perpetuate this swag stereotype the next time you find yourself having a conversation with somebody that discloses that they're struggling with their body image, weight, shape, size, or food. You can take them seriously and hear their concerns. You can perhaps direct them to charities such as Uppbeat, who can offer support via their helpline or online services. You can also share this video and start to pass on some of this awareness that eating disorders come in all shapes and sizes. For today, World Mental Health Day, but also tomorrow, the next day, and the next day. This isn't going to be a quick change, but those thousands of people struggling perhaps entirely alone with their eating disorder deserve better access to mental health care services. I'm going to leave it here today, but I do just want to wrap up by giving you a little bit of an insight into what my plans are for creating content here. You might be watching this video directly on YouTube, or you might be watching this video on my website, mentalhealthbites.co.uk. If you haven't already seen, about 10 days ago, I released a blog post, which you can access by clicking right here, which explains what happened to all of my old content. But moving forward, perhaps more importantly, what you're interested in is what are my plans now? Well, my plans are to be creating both blog and video content, working towards creating a library of bite-sized content across the mental health and eating disorder spectrum. If you found that today's video is helpful, I'd really appreciate it if you would support these efforts by giving me a thumbs up, by subscribing if you haven't already, and as I already suggested, by sharing this video. I'm going to be regularly putting out content on both of these channels, and I would also be really interested to hear what topics you might be interested in me covering. You can also leave those in the comments wherever it is that you're seeing this video. Well, until next time, be kind, be curious, be yourself.